everyone, thanks for joining. We're going to get started now. Today we're joined by Dr. Brown, who will be presenting the science tables modeling, so I'll turn it over to him to get started.
Thank you. And I'll apologize now. When the presentation does start, the sign language, will stop, but it will come back immediately after the presentation. Now, I'm back to speak with you today because of the emergence of the Omicron variant in Ontario. We're still learning about this new variant. It emerged only last month, but it's important to talk about what we do know. First, it transmits incredibly fast. Doubling time for cases may be down to just over 2 days now, compared to 4 days or more with previous variants. It does cause serious disease. Hospital rates have risen in South Africa, where it first took hold. It's not just a case of the sniffles. And our Pfizer and Moderna vaccines, particularly with a booster, provide strong protection against serious illness. And with the booster, they also provide protection against infection. The Omicron variant transmits fast enough that it is already the dominant variant in Ontario. It is not clear whether it will completely replace the Delta variant, but it is clear that it will shortly account for the overwhelming majority of cases. We're still learning much about this variant, about mortality, its relationship with long COVID, and other issues. But the broad picture of being highly transmissible and serious is clear. I'll present modeling today based on the work of 5 teams from across Ontario. The modeling shows that cases will likely dramatically increase very soon. We, like other strong modeling teams from around the world, believe that it is best to treat the Omicron variant as if it were as serious as the Delta variant. But our modeling also shows that whether it is as serious as Delta or 25% less likely to produce serious illness, our hospitals will still face incredibly strong pressures. This will come at an already challenging time when healthcare workers are fatigued or burned out from the preceding waves. If we want to blunt this wave, and please note that I'm saying blunt it, not flatten it, we will need to reduce contacts between people. I believe we can do this without closing schools or shutting down businesses that have suffered during previous waves. But it will take serious restrictions that reduce contacts. This is a hard decision. At the same time, we need to drive boosters up as high as possible to protect vulnerable individuals and vulnerable communities. And we need to keep vaccinating kids. But neither public health measures nor vaccinations will be enough on their own to blunt the Omicron wave. Public health measures will slow the spread of Omicron, but they are not sustainable in the long run. Vaccination provides our exit plan from the pandemic, but it takes a while to take effect. Regardless of the policies that will be enacted, we should recognize that we are fortunate to have the capacity to provide boosters when many countries are struggling to provide first doses. We should remember that our choices help limit the spread of the disease. Wearing a high-quality mask properly, physical distancing when indoors, improving ventilation wherever possible, increasing access to rapid testing, they all help, and they help make sure that we can keep schools open and keep sectors hard hit by the pandemic working. This will likely be the hardest wave of the pandemic. But if we can control it and drive vaccination as hard as we can make it to the exit. And there is an exit plan from the pandemic. We just need to push as hard as we can and control its immediate impact as much as we can tolerate. I started by saying that we are still learning about the pandemic. There is still some uncertainty, but there's also an undeniable urgency. Waiting to take action means waiting till it is too late to take action. Now, on to the key messages and numbers. And my apologies, the ASL translation will disappear for a few minutes while we do the presentation, and we'll return for questions. We can go to the presentation, please. Let me start with the key findings. Cases are climbing across most public health units. And when we put together these slides the other day, we felt that it would be soon that the Omicron variant would be the dominant variant. It is likely the dominant variant already today. Omicron transmits very quickly. Early evidence suggests that it can produce severe disease, and without prompt intervention, we expect that ICU occupancy, a key measure in our fight against this pandemic, could reach unsustainable levels in early January. Although vaccines are less effective against the Omicron infection, boosters can substantially increase protection. And even 2 doses of our mRNA vaccines likely provide strong protection against severe illness. The risk of severe illness is dramatically higher in the unvaccinated. We can help protect the most vulnerable with vaccination, meaning here both children and the use of boosters. Rapid rollout of booster doses is essential, with a strong focus on the most vulnerable, people in long-term care, people in shelters, people in high-risk communities, and on healthcare workers. Increasing vaccination is not enough to slow this wave. We'll talk today about circuit breakers with strong additional public health measures, reducing contacts down by about 50% or more, and strong booster campaigns of about 250,000 per day as a way to blunt the wave. As well, continued use of public health measures, use of high-quality masks, physical distancing indoors, improved ventilation, and increased access to rapid testing can help buy time for boosters to take effect and keep schools open. Although uncertainty persists, waiting for more information will eliminate the opportunity for action. I'll start here, just to put the situation in Ontario in a global context. The left-hand panel shows the growth in COVID-19 cases. That is both Delta and the beginnings of the Omicron wave. The next panel, the middle panel, shows COVID-19 patients in ICU. As you can see there in that red line, we've been lucky in terms of keeping our ICU rates roughly stable, but there is significant rises in other parts of the world. And you can see here on the final panel on the right-hand side, COVID-19 deaths. Turning to Ontario, we show this slide, I think, every briefing. You can see that cases are increasing in most public health units. And this chart, unfortunately, from the other day is already out of date. Rates in public health units like Kingston, Frontenac, KFLA are much higher already. And you can see them growing across a number of these public health units if we update it to today's date. Here I want to show a story about Omicron and the Delta variant. The left-hand panel in the blue shows the dramatic increase in Omicron. I want you to look at the slope there. It's very, very steep. But you can see there is still growth in Delta at the same time, but a much less steep slope. And so important to kind of note that we have a dramatically more transmissible disease here in Ontario. This is Ontario data with Omicron. But we have seen, up until now at least, a continuing increase in the Delta variant as well. There's been a lot of discussion about South Africa and the experience, particularly in one of its provinces called Gauteng, as being evidence of Omicron's lower severity. But I'm going to show 2 slides now that talk about whether or not that is a reasonable assumption about the severity of Omicron. If you look at the left-hand panel, I'd again like you to take a look at the slope of the lines. The blue line dealing with the left axis, the blue line dealing with the right axis is COVID-19 patients in hospitals. The orange line is COVID-19 patients in ICU. The softer orange line is receiving mechanical ventilation, and the yellow line is with supplementary oxygen. You can see that all of these indications of the severity of the disease are trending up. Thankfully, the ventilation indicator is not trending up as quickly, but there is reason to suspect that that will start to come up. That's generally a lagging indicator. If you look over on the right-hand panel, you can see deaths in hospital in Gauteng again, and that is also trending up. But I want to caution, even maybe a very small amount of optimism on what we see here should be very, very, very muted. Gauteng is a much younger province. The average age is the median age there is 27 years. The median age in Ontario is 41 years, and age is still one of the most important factors predicting outcomes. You have a number of people who've already been infected with COVID-19, and that gives them a certain degree of immunity. That's a much lower number here in Ontario. And we have a number of people in Gauteng and in South Africa who have probably both had 2 vaccines and a previous infection, giving them a higher level of immunity. The number here in Ontario is probably half of that or less. And so you can see that this is still a serious disease in a younger population that is at less risk of serious outcomes. It's still a serious disease in a country where there's been a substantial amount of infection conferring some degree of immunity, and it's still a serious disease in a country that has seen high mortality in previous waves, showing that it's still able to find people and have serious consequences. I'll go here again to 3 slides again, talking about what's going on in South Africa. The left-hand panel is the slope of cases. Wave 4, this is Omicron, is there in orange, and you can see that it's that very sharp line straight up on the left-hand side of the left-hand panel. The middle line is admissions to hospitals. And again, we've shown all the waves here on these charts, but that orange line at the far left side, you can see that slope up again. That is the slope for hospitalizations in this 4th wave, and you can see it taking off in the same way. The far right-hand panel is deaths. You can see that that is lower. I think we need to wait to interpret this statistic because deaths would be very much the lagging indicator. But it is increasing, but thankfully now not increasing as much. Maybe to also give a sense of where we are in terms of penetration of Omicron, about November 15th, South Africa hit 50%, and about 2 weeks later, they saw the increase in hospitalization. We're here in Ontario today on December 16th, where South Africa was on November 15th. So we should start to see that hospitalization rise in a very short period of time as we get to see Omicron be the dominant variant. This data is from Denmark, and it is early data. I want to emphasize it's very early data. But if you again look at the slopes of these lines in that chart, cases are going up and hospital occupancy with COVID-19 is going up. And if you look at the table underneath, you can see that the risk, not really the risk, but the percentage of people who are hospitalized with Omicron is about the same as were hospitalized with other strains. Now, this is early data, and it's important to emphasize it's early data, but you can see that it's actually roughly the same. And as we look around other jurisdictions, for instance, looking at data that was on social media today from the United Kingdom, there is no sign of a decoupling between cases and hospitalizations. We see that rise again in hospitalizations in the United Kingdom. We've seen a substantial jump in the number of patients in hospital in London, England, over the last little while. And to perhaps give a sense of how quickly this spreads, if we go back to Denmark, they reported nearly 10,000 new cases this morning. That's on a population of 5.8 million people. So a very, very transmissible disease that grows very quickly, a disease that does have serious consequences, at least in terms of hospitalization when we look at it. Let's turn to the effectiveness of vaccines. The chart here shows the effectiveness of the mRNA vaccines, or actually in this case, I'm sorry, it's the Pfizer vaccine, of the Pfizer vaccine against the Delta variant and against the Omicron variant. The black squares are the Delta variant, and the gray circles are the Omicron variant. And you can see as we move along the chart, as we move farther and farther away from that second dose, you see the effectiveness of all of those vaccines wane. And you can see the effectiveness against Omicron is lower. But I think important to note that the booster increases that effectiveness dramatically again. That's the far right-hand piece of data. And you can see that the effectiveness goes up again substantially for both the gray circles and the black squares for both the Delta and the Omicron variant. Really, I think, reinforcing the importance of boosters for preventing symptomatic infection and actually for preventing infection as well. Now, this is a very dense slide, and I'm not going to read it out, but we thought it was important, given that we are both coping with emerging evidence, but also the seriousness and the substantially different threat posed by Omicron, to have a slide that detailed some of our assumptions. I've already talked about doubling time being down now around 2 days. R effective is highest we've ever seen at around 4.5, I think, today on our dashboard. So this is a disease that transmits very, very, very quickly and very widely. And it's important to note here that we've used those data when we've done these estimations. We have assumed, based on the data that I just presented, that Omicron creates as serious health consequences as the Delta variant. We have also, though, modeled 25% less severe cases. based on some early data out of South Africa that had suggested in some populations this might be the case. And we have modeled vaccine effectiveness as I discussed. When we get into the modeling, you'll see wide ranges. This is, of course, based on trying to understand how different assumptions affect these ranges, but I will talk about where the preponderance of the estimates go and where we expect things to be. So, again, this is modeling based on the work of 5 teams. We bring it together to try to create a consensus estimate so that we're not having movement too much in one direction or another. If you look at the red area, this is where we expect cases to be between now and the 1st of January if there are no additional measures. This does include continued progress on historical averages of booster doses. You can see there's a wide range here with the high-end range taking us up to over 10,000 cases very quickly. A lower-end range that still takes us up very high to over 6,000 cases by the end of the month. And you can see really what is driving that sort of wide range there is assumptions about vaccine effectiveness. The lower range, obviously, is we believe vaccines are 100% effective, which we know at least or believe from the data so far that they are not. You can also see a green area there at a much lower level of cases that does not get as high as our historic daily case report high levels. This is what we described as a circuit breaker. This is where you would see a substantial amount of vaccination, really equivalent to about 250,000 to 350,000 booster doses and vaccinations for children a day, and a substantial reduction in contacts. It's not a lockdown, it's not a stay-at-home order, but it does require reduction in contacts. Here, just wanted to kind of show a chart again that we always show. We've been relatively stable for the last little while in hospitalization and ICU occupancy. That is good, but you can see just at the tail end of the chart now, and again this only goes to about the 8th or 9th of December, there has been an increase over the last 4 weeks, both in the number of COVID inpatients, about a 25% increase, and an increase in the number of patients in ICUs with COVID. And that's been, again, about a 25% increase. So we are already trending up, and we have not yet seen the impact of the spread of Omicron. And, of course, the spread of Omicron, if it is as serious as we believe it is, will cause ICU use to rise substantially. With no additional measures, we expect that it would easily be over 400 or 500 cases in the ICU by the end of this month, and could be substantially higher under our worst-case scenarios. You can see that a circuit breaker does help reduce the impact of the Omicron variant on our ICUs, but it still does get up over 300 on a number of those sort of circuit breaker type scenarios. So wide range, but still most of our scenarios and most of our where we're actually with our current trend right now suggests that we are tending towards the higher end of the red area. Now, one of the concerns that has been raised, or one of the issues been raised, is Omicron may be less severe than Delta. We don't believe there is strong evidence of that for a number of reasons that we discussed earlier. But you can see here that even if Omicron is less severe, if it's 25% less severe than Delta, you will still see ICU occupancy rise. With no additional measures, again, our models tend to suggest that by the end of the month, we could still be over 500 patients in the intensive care unit. And even with a circuit breaker, we still do get up to just about 300 again. So the high transmissibility means that the decrease in severity has to be so substantial to make up for that high spread of the disease. I think important to note as well, although there will be breakthrough infections, people who are unvaccinated are at substantially greater risk. They are at the greatest risk of ending up in ICUs. Now, we've made a lot of progress on vaccine coverage across a number of groups. If you look here at the left-hand panel, we're talking about vaccine coverage for Ontarians between the ages of 5 and 64 years. The left-hand set of bars is people who've had at least one dose. The middle set of bars is people who've had 2 doses. And the far right-hand set of bars in that left-hand panel is people who've had 3 doses. You can see that actually we have a substantial number of people who've had 2 doses, but almost no one who's had 3 doses. Now, I want to talk about what each of the types of colors mean here, what each bar means. Yellow are individuals with any high-risk condition. The analysis done at ICES helps us understand people who are at greater risk of disease and serious outcomes. You can see it is the highest, but still substantially below where we'd want to see it to truly provide protection to people who are highly vulnerable. The orange bar shows people who don't have any of those conditions listed, so they're still at risk, but it's a lower risk. And we've shown here the blue bar, people with recent experience with homelessness, who are at great risk, crowded conditions, high-risk conditions in shelters, other issues that cause a greater risk of serious disease, and you can see it is quite low. And again, you see that same pattern for people who've had a 3rd dose in that chart. And so very, very low 3rd dose coverage for a lot of people who are at very high risk. If we look on the right-hand panel, we can look at vaccine coverage over 65 years of age. And you can see here that we have a better coverage, which is good because age is a critical factor in understanding risk. But again, you can see across all of those bars a decrement. And again, although it's higher than those who are younger, you have a much lower level of vaccination with 3 doses. So looking at this, it is really critical as we hit the surge in Omicron cases that people get their booster dose as soon as they can because it does take a while for the effect to kick in. So this is a very, very challenging situation, and it's a very challenging set of data to present because although there is uncertainty about some of the parameters, and we've tried to make clear our assumptions in all of this modeling, there is an incredible urgency because of the speed of which it spreads. What I do want to point out is that despite the seriousness, with prompt action, we can slow down and we can reduce some of the impact of this wave. So we've talked a lot about circuit breakers. They really slow down infection and give us time to get boosters into people and for those boosters to work. Accelerating as fast as we can, not just broad boosters, but boosters for the most vulnerable, and for healthcare workers and their families and caregivers will help reduce the transmission to vulnerable people and help protect the health workforce. The reason that we've called out families here of healthcare workers is that helps protect against household transmission, which could then lead to transmission back into a hospital, back into a long-term care home. And so we're trying to create really as great a level of security with this advice around healthcare facilities as we can. Regardless, we can help keep schools and workplaces and places where people gather indoors safe by reinforcing, or at least safer by reinforcing the importance of key behaviors and public health measures. Although we've talked about vaccination and we've talked about boosters already a lot, obviously the first thing is please get your booster. Please wear a well-fitted, high-quality mask. Do practice physical distancing and avoid indoor spaces where there's crowding. If you can, increase ventilation in indoor spaces and make sure that you use rapid testing. It'll be important that we match the distribution of therapeutics, drugs. There are some that now help. There are monoclonal antibody treatments that help to where they're needed most to mitigate the impact of potential shortages. And it's important to point out that although uncertainty persists, waiting for more information will eliminate the opportunity for action. Anything that we can do here helps, and we will all need to help to control and help blunt the impact of the Omicron variant as we try to get through this wave. I'll have this as my sort of second last slide just as a visual. There's no type of thing that you can do that is 100% protective, but there are a series of things that you can do that help substantially reduce the risk of infection. And so first and foremost, the always category, please get vaccinated. It is, as I said earlier on, the exit plan from this pandemic. Please wear a mask indoors. Please, if you can, stay outdoors or in well-ventilated spaces. And when it's possible, please practice physical distancing. And if you can, please avoid large gatherings. I won't repeat the key findings other than to emphasize that this is a very, very different variant. And it may be closed by saying that although this is an incredible threat, both to health and to our health system, we do have a tremendous amount on which to base hope, not least of which are the vaccines. But it must be hope built on action. Anything that we can do now, whether as an individual or as a province, will help. And please get vaccinated as soon as you can. With that, that's the end of the slideshow. I'll just go one more. And the contributors and the members of the science and modeling tables are here. And I'm grateful for their support and their incredible work over the last 18 months. I'm pleased to be able to serve with them. Thank you.
Lines for questions. Just a reminder, one question, one follow-up. Over to the first question, please.
From Christopher Harp at CP24.
Hello, Dr. Brown. What else beyond limiting indoor capacity in venues with 1,000 or more regular occupants do you think is needed when you speak of new public health measures? And how does this model specifically define a circuit breaker?
So on the last question, there's a range with a circuit breaker that we're considering. What we're really talking about when we talk about a circuit breaker is reducing contacts by 50% and pushing the level of vaccine administration, boosters and to children, and even first vaccines, up to about a total of 250,000 to 350,000 a day. It's the question about the public health measures. It's specifically those things that reduce contacts. And so that may be capacity limitations in different settings. It may be a stronger enforcement of masking indoors. I think we've all seen some diminution in people actually following, wearing a mask properly. It's not really anything any sort of new things that we haven't seen before. It's those core public health measures.
What do you make of the suggestion by some epidemiologists and health leaders that everyone in the province, regardless of how they limit their contacts or their vaccination status, should just offhand expect to experience COVID-19 infection in the next month or so because of the unbelievably increased transmission compared to previous variants? Is this a credible assertion based on what we know?
The data is very clear that this is incredibly transmissible. If we were seeing in Toronto or the Greater Toronto Area the type of explosion of cases that they've seen, say in Kingston, you might have 10 to 20,000 cases in the GTA right now. And so this is an incredibly transmissible disease, and the levels of infection that we see in other jurisdictions are really high. I do believe that if there was strong public health measures, you would be able to blunt that transmission by enough to buy some time for boosters. That might mean that there still is broad spread, but I do think that you can control some of that transmission.
Next question.
Yeah, please go ahead.
Hi, Professor Brown. You said you don't believe the evidence shows Omicron is less severe, yet the Public Health Agency of Canada said the other day, I quote, all cases to date have been asymptomatic or mild. The other day, the EU CDC said all cases in the EU for which there is available information on severity were either mild or asymptomatic. We see prominent doctors in various countries have taken to the mainstream airwaves to insist that this has been mild. So my question to you is, well, why should the public accept the Ontario Science Table's perspective on the severity issue over all those other voices?
So I showed you earlier on in the presentation the data from Denmark that is publicly available data. I think it's worth taking a look at, but that does show a similar risk of hospitalization, which I would consider a serious health outcome. We've looked at the data from South Africa that is now starting to show that trend upwards. And even the data out of South Africa talked about a 23%, and this is the most optimistic data, a 23% diminution in hospitalization. That's not sniffles. That is hospitalization, which is a very serious health outcome.
Follow up?
Yeah, speaking of hospitalizations, I understand the prevailing concerns justifying the measures you recommend are that we will see 400 or 500 persons in the ICU. A massive amount of the provincial budget goes into the healthcare system, and there are a lot of people paid a lot of money to manage this system. But why do you think it is that they have failed to properly manage for this presumably preventable moment where the burden is now once again expected to fall on regular people?
I think that's an unfair statement about some very, very hard work by people within our system over the last while. If you take a look at what they've done in terms of moving patients around the province to try to manage load, if you look at how hard doctors and nurses have worked, I don't think that the assertion that they've mismanaged and failed the people of Ontario is fair or true.
Next question.
From Jeff Gray at the Globe and Mail.
Oh, hi, thanks. Dr. Brown, just about the circuit breaker, the start date that you modeled December 15th, which is yesterday. This weekend there's kids playing hockey in tournaments. There's people shopping. Restaurants are still at full capacity. These are all things that should be stopping, aren't they? If I look at these graphs.
As we talk about almost every time when we do these briefings, if you want to control the growth in cases and you want to control the impact on the health and health system, you have to reduce capacity, and it would need to start now. Because of the speed with which it spreads, the cases that we see today, the cases that we see tomorrow, the cases we see on Sunday, will be the hospitalizations in 2 or 3 weeks from now. And so every day that you wait, you've got bigger spread and you've got a greater challenge in front of you. Now, I've talked a lot about the uncertainty and the urgency. It's a very, very challenging place to model right now. I've tried to talk about why we think it is as serious. But I recognize that these are very, very hard decisions. And I don't think that we need to necessarily stop things full out. I do think it's important to kind of maintain activity in a number of very hard-hit business sectors, maintain kids at school.
Next question.
Just to follow up on that, school's about to close for the holidays. Does that help us at all? Or are we going to have to issue, an order that says families shouldn't gather for Christmas?
I think that's really the decision of the Chief Medical Officer Health. If we're able to increase vaccination, if you're able to make sure that you're associating with people who are vaccinated, if you're able to increase ventilation as much as you can, if you're doing all the things like wearing a mask properly, I think it is okay to see some family at Christmas, but that's really the purview of Dr. Moore.
Next question.
From Colin DeMello at CTV News.
Hi, good morning, Dr. Brown. I know this always puts you in a very tricky position to comment on the policies that the government brought into place. But, yesterday we saw capacity limits at large venues with 1,000 plus cut down to 50%. In your view, and that's only coming into effect on 12/01 on Saturday, in your view, the measures that were announced yesterday, will they be enough to avoid that 10,000 a day scenario?
So anything in that, any measures will help reduce, but they're not enough to really curb the rapid growth of the variant.
Follow up.
Okay, and so if you can clarify then, what specifically additional does the government need to do in order to, blunt the wave to a degree where we don't overwhelm the hospitals? And if I can also add on just about the airborne nature of this virus, do you agree that the Omicron variant or COVID-19 in general is airborne? And what specific type of mask is necessary to protect healthcare workers, teachers, and the general public?
Sure. So I think that's 3 follow-up questions. Let me start on one of them. It's an airborne disease. I think that's clear. I think the highest quality mask you can get is useful. I think there's broader questions that should be addressed about types of masks and so on, and I think there's guidance coming out on that shortly, but those should go to the Chief Medical Officer of Health.
Next question.
From Lorenda Redekop at CBC News. Please go ahead.
Hi, Dr. Brown. We've got bars and restaurants still at 100%. Nightclubs are still operating, and this at a time when we've got Christmas and New Year's just around the corner. What would be your recommendation to the government and also to the people of Ontario?
So to the people of Ontario would be, I think, very clear. Please get your booster. If for some reason you haven't gotten vaccinated yet, please go get vaccinated. That protects not only you, but it protects people around you. The points that we talk about, that second last slide about all the layers of protection, please do wear a high quality mask. Please do try to physically distance. Please don't get yourself in crowded indoor spaces where there's poor ventilation. Those are all important things that people can do, and the nature of the disease has accelerated. It's much more transmissible. With the Delta variant, we saw it become more severe. But the fundamentals of how we control spread haven't changed, although they may be less effective. In terms of what we can do at a provincial level, we've considered models where we're dropping contacts between people by at least 50%. That would require capacity limitations of some sort. It would require different approaches to making sure that people are not engaging in the type of behavior that's going to lead to an increased risk of transmission. But there's a variety of different sort of ways that you could approach that.
Follow up?
You were asked many months ago if your presentation at the time was predicting a disaster. You say that this will likely be the hardest wave of the pandemic. What is this presentation predicting?
So it's predicting a remarkably rapid increase in the number of cases. And that in itself is worrisome. We don't know the relationship between this variant yet and long COVID or post-acute COVID. And so you are putting a whole bunch of people at potential risk. Earlier variants had a risk of long COVID of perhaps maybe 10% with different types of symptoms. At the same time, if our assumptions about severity are right, you'll also see a huge increase in hospitalization, which is challenging to manage with consequences for health. And if the assumptions are correct, an increase in ICU use to the point that the ICUs are unsustainable, likely sometime in January. And obviously increases in mortality as well. I'm trying to be very careful here to say, based on the assumptions we're making, I'm trying to make clear where we're getting the data for those assumptions. There is a lot of uncertainty. The challenge is, though, that we didn't want to wait another week to release our usual modeling as we get more and more data, because the opportunity for action does shrink. And so it could be a very, very, very significant hit on the health of Ontarians and on the healthcare system. And it could be, as I said in my presentation, it could be the worst wave of the pandemic yet.
Last question.
From Rob Ferguson at the Toronto Star.
Hello, Dr. Brown. Just wondering, just getting back to the circuit breaker stuff, I was out for a walk last evening, and I saw people crowded in gyms, crowded in bars with live music. What is your advice to people who are still going to gyms and whatnot, and bars? What would you like to see there? Should people just be seated at tables and leave it at that with capacity restrictions?
So I think this is a really hard question, because it is a question that you have to consider both the impact on these businesses and the impact on the spread of the pandemic. And it's not a question I'd ever want to be faced with making a decision on. I do think that anything we do here to reduce contacts will be helpful in controlling the pandemic. I do think that if you saw capacity reductions, you would actually see some break, hopefully, on the spread of the disease. But I know it's hard. I know it's hard to go to the gym and find out that it's crowded and have to leave. I know that it's hard to go to, the place, a local restaurant or a local bar that you go to every week and see it's crowded and not go in. I understand that. But I think anything we can do to reduce, at a societal level, reduce crowded places is helpful. And avoiding really crowded places as an individual will probably help break this wave.
Follow up, and this is the last question.
Yeah, thank you. We haven't seen you for a while. What happened there?
Well, there wasn't much to discuss during the summer. As we've come back to modeling in the fall, we have put it out publicly, and I will come to present the results anytime that we're invited to come present it.
Thanks, everyone.